Over 60, and noticing an itchy spot you've been ignoring? For years, many men have been told that an itchy patch is just dry skin, just age, or just the weather. But here's the truth. While most itchy spots are harmless, a persistent, changing, or bleeding patch can be an early warning sign of skin cancer, and early means solvable. I'm Dr. Linda Parker, here as your guide in men's health and longevity. My purpose today is simple and direct, to show you 7 signs men over 60 often ignore, exactly how to check your skin in 90 seconds, and when to act so you protect your confidence, your independence, and your future. Let's set the frame. Skin cancer is common, but it's also highly treatable when caught early. The challenge isn't the treatment, it's attention. Men, especially after 60, tend to shrug off little changes, a scab that keeps coming back, a rough spot on the scalp under thinning hair, a tiny bump on the ear that snags the towel, a streak under a nail you think is a bruise that never happened. Meanwhile, years of sunlight collected on your shoulders, ears, nose, and scalp quietly add up. Today you'll learn what's noise and what's signal, so you can decide with calm and precision. Before we dive into the 7 signs, a quick orientation you'll actually remember. Think of the skin like a map with 3 high-risk zones for men over 60: the scalp and ears, the nose and cheeks, and the shoulders and upper back. These areas have absorbed the most sun across decades. Add the hands and forearms, the lower lip if you've worked outdoors, and the tops of the feet in warmer climates. Darker skin tones are not immune. They simply present differently and later, often on palms, soles, nails, and places you don't think to check. Everyone needs a plan. Sign number 1. The itch that isn't normal for you and doesn't quit. An itchy spot that sticks around for more than 3 weeks and feels different. Localized, slightly burning or prickly, sometimes with a light crust, deserves your attention. It may be a harmless dermatitis, but persistent itch with a subtle change in color or texture can be an early signal of a non-melanoma skin cancer, particularly on sun-exposed areas. The key word is persistent. Temporary dryness improves with simple moisturizer within days. A concerning spot returns or never truly resolves. If you catch yourself scratching the same point on the scalp, the ear rim, or the shoulder over and over, that's a red flag to check and document. Sign number 2, a pimple or ingrown hair that doesn't heal and bleeds easily. Men often nick these with a towel, a hat, or fingernails. If a spot bleeds with minimal friction, scabs, then reopens in the same place repeatedly, it's not acting like a pimple, it's asking to be examined. Pay special attention to a shiny, pearly bump with a slight rolled edge, sometimes with tiny visible vessels on top, or a flat, firm, scaly patch that slowly enlarges. You don't have to name the type. Your job is to notice the pattern: easy bleeding, slow growth, never quite gone. Sign number 3. A rough, sandpapery patch that you can feel more than see. Run your fingertips across your temples, the top of your ears, the nose bridge, and the scalp if your hair is thin. If you find a spot that feels like fine sandpaper, flakes, returns after you moisturize, and is tender in the sun, treat it as a signal. These patches can be precancerous changes that deserve a clinician's eye. Men miss them because they're subtle and painless, until they're not. Texture tells the story early. Your fingertips are your best tool. Sign number 4. A new spot after 60 that looks unlike any of your others. In skin checks, doctors use a simple rule called the ugly duckling, the mark that doesn't fit your personal pattern. Maybe all your freckles are light and flat. Then one new spot appears darker, pinker, glossier, taller, or lonelier. New matters, different matters, and changing matters. It's not about panic, it's about pattern recognition. If you notice a newcomer that keeps evolving, that's your cue. Sign number 5, a mole that changes shape, border, color, or size, or a firm, dome-shaped bump that seems to appear out of nowhere. Classic mole checks mention asymmetry, irregular borders, multiple colors, diameter bigger than a pencil eraser, and evolution over time. That's useful. But men over 60 also need to watch for fast-growing, uniform-colored, dome-like bumps that are firm to the touch and tender. Rapid change deserves prompt evaluation. Think. The slow molasses changes give you weeks to act. The sudden, steady, obvious ones ask you not to wait. Sign number 6. A dark streak under a fingernail or toenail that wasn't caused by trauma and doesn't grow out. If you can't remember slamming your finger or toe, and yet a brown or black line appears within the nail, especially if it widens or the surrounding skin pigment spreads, get it checked. Men often blame these streaks on shoes, golf, or gardening. Nails tell stories about time. A bruise grows with the nail and moves forward. A concerning streak stays rooted and may broaden. Photograph it once, then again 2 weeks later. If it's stable and obviously due to an impact you remember, fine. If not, act. Sign number 7, a sore or scaly spot on the lip, ear rim, or nose that won't fully heal. Outdoor work, fishing, golf, and decades of sunlight can leave the lower lip dry and cracked. That's common. What's not common is a single rough, tender patch that crusts, splits, and never truly closes, or a firm sore on the ear rim that bleeds easily under your hat. Lips, ears, and the tip or bridge of the nose are classic "don't ignore me" zones. If a lip spot tingles, burns with sun, or cracks in the same place over and over, that's a sign to schedule an appointment. Now that you know the 7 signs, here's the 90-second shower check that actually fits your life. You'll do it once a month, ideally on the same date. After a warm shower, in good light, stand in front of a mirror with a hand mirror or your phone camera ready. Start at the top. Run your fingertips across your scalp, especially cowlicks, part lines, and bald spots. Feel for those sandpapery patches or tiny bumps you didn't notice before. Check the ear rims, front and back, and behind the ears where the mask straps used to sit. Glide to the face. Nose bridge, tip, cheeks, temples. Lift the eyebrows to see the upper lids for any new pigmented patches. Open your mouth and look at the lower lip edge. Move to the neck and shoulders. Turn slightly to the side and look for shiny, pearly bumps or rough patches. Use your phone camera as a second mirror to scan your upper back. If you live with a partner, ask for 30 seconds of help once a month. Trade checks so you both benefit. Continue down the arms and hands, front and back, including between the fingers. Look at your fingernails for streaks that weren't there a month ago. Check the chest and abdomen. For the waistline and lower back, turn, snap a quick photo, and compare next month. Then the legs, front and back, knees, shins, calves. Don't skip the tops of your feet and between the toes. Finally, your toenails. If something catches your eye, a new, changing, bleeding, or persistent spot, take a clear photo today, then the same photo in 2 weeks. Stability is reassuring. Change is the cue. Let's talk about risk without fear. Sun history matters. Years of outdoor work or sport, childhood sunburns, and fair or easily burning skin increase risk. But darker skin tones can also develop skin cancer. It just appears less often in sun-exposed areas and more often on palms, soles, under nails, and places that aren't on your radar. Age matters because your skin has lived more stories. DNA repairs are slower, small mistakes accumulate. Medications that suppress the immune system and a personal or family history of skin cancer also raise risk. None of this should scare you. It should guide you to use your eyes, your fingertips, and your calendar with intention. What do you do if a spot meets one of the 7 signs? You schedule an appointment within 2 to 4 weeks with a clinician who examines skin regularly. You bring 2 photos, day 1 and 2 weeks later, taken in the same light if possible. You describe it simply. New spot on right ear rim, bleeds with towel, hasn't healed in 3 weeks, or dark line under left thumbnail, no trauma, looks wider than 2 weeks ago. You don't need perfect terminology. The clarity of your observation does the heavy lifting. Avoid masking the area with strong steroid creams without medical guidance. They can temporarily quiet inflammation while the underlying issue progresses silently. Keep it clean, avoid picking, and get it assessed. How is early skin cancer treated? Most early lesions are handled in a clinic setting with local anesthetic and minimal downtime. The goal is complete removal with a comfortable margin. Early means smaller procedures, quicker healing, and better cosmetic outcomes. That's why we focus on seeing clearly and acting calmly, not catastrophizing. Let's anchor these ideas with 3 short real-life stories that stay with you. Hector is 64 and fishes every weekend. He kept picking at the same scab on his ear rim after drying his hair. His partner finally said, "That's the same spot from last month." He took 2 photos 2 weeks apart. Same place, same scab, still bleeding with a towel. He got it checked. A small lesion caught early, removed in a short visit. His only regret was not going sooner. His words, "That towel was trying to tell me something." Marcus, 61, noticed a bruise under his big toenail, but he didn't recall stubbing it. He waited 2 months. The line didn't move forward with nail growth. It widened slightly. He took photos, sought care, and got it evaluated early. The outcome was manageable, and he kept walking every morning without missing a beat. What changed his mind? The "why would a bruise stand still?" question. Dan, 70, had a sandpapery spot on his scalp he could feel while washing his hair. He moisturized. It came back in the same place. 3 weeks later, still there, same feel, slightly larger. He scheduled an appointment, had it treated early, and went back to gardening with a hat and a smile. His phrase, "Texture told the truth." Now, let's turn knowledge into a simple, repeatable plan you can live with. First, pick your monthly skin check date. Your birthday number works well. Mark it on your calendar. Second, make Sun Smart part of your morning. A broad brim hat, a few seconds to apply a high-quality sunscreen to the face, ears, scalp if needed, and the backs of the hands. Third, stop guessing about your spots. Start capturing them. If something looks new, different, bleeding, or stubborn, photograph it today and again in 2 weeks. Fourth, know your appointment window. If a spot bleeds easily, doesn't heal in 3 weeks, or changes quickly, book a visit within 2 to 4 weeks. Fifth, upgrade your everyday protection. Wear long sleeves when you can, choose sunglasses that actually cover the sides, and keep a lip balm with sun protection in your pocket if you work or play outdoors. Because I specialize in men's health, I want to connect this to your bigger goals: confidence, independence, and longevity. You can lift weights, eat well, and sleep better. But if you ignore a small warning on your skin, you're leaving an easy win on the table. Early action isn't fear. It's leadership over your own life. That itchy spot might be a dry patch that fades. That's great. But if it's one of the 7 signs, catching it now is the difference between a quick visit and a bigger procedure later. You deserve the quick visit. If you prefer a minimalist approach, here's the 90-second routine one more time, condensed into a mantra you can remember. Top to toes, once a month. Feel for grit, look for bleed. Photo now, photo in 2 weeks. If it changes, I book. That's it. No drama. Just a system that protects you quietly. You might be wondering, what about the spots in places I'm embarrassed to check? Here's a respectful answer. Every inch of your skin is part of your health. including skin folds and areas that rarely see the sun. If you notice itching or a new mark in a private area that doesn't settle in a few weeks, treat it with the same clarity. Photo, 2-week recheck, and book if it persists. This isn't about judgment, it's about staying strong for the people you love and the life you're building. Sometimes men ask, "What if I waste the doctor's time?" You won't. Clinicians would rather see 10 harmless spots early than miss one significant lesion late. Early is kind to your body and your schedule. And just as you service a car before it breaks, you check your skin before trouble grows. It's practical, not paranoid. Let's end with a single, powerful sentence you can carry into the rest of your week. Small changes you notice early are the easiest to fix. That's the whole strategy. Notice early, act calmly, and move on with your life. If this talk gave you clarity, take 90 seconds today. Do the shower check. Snap a photo of any spot that meets one of the 7 signs, and set a reminder for 2 weeks. Share this with a friend who still thinks it's just dry skin. And if you want more practical guides for men's health, confidence, circulation, and longevity, subscribe and tell me below which of the 7 signs you're going to watch for this month. I'm Dr. Linda Parker, and I'm here to help you stay strong, steady, and one step ahead.